I'm here with Jennifer Smith, Secretary of the Department of Drug and Alcohol Programs. Secretary, can you tell us a little bit how COVID-19 has really impacted your department within the Wolf administration?
Sure, thanks for asking. So what's really interesting from my department's perspective is that prior to COVID-19, we were already dealing with a pretty significant public health crisis. We've been battling an opioid epidemic for many years now, and that opioid epidemic is transitioning slightly into a stimulant epidemic. And we've been grappling with that in terms of prevention, treatment, and recovery supports. And so to add a second public health crisis on top of what we've already been dealing with has been very difficult for our field. And many of our providers are experiencing the same types of issues that other healthcare providers are experiencing related to COVID-19. There's shortages of PPE, the equipment necessary to properly treat those patients. There's workforce shortage issues, there's financial strain. So we're dealing with all of those same things that they're working with, on top of trying to continue to address an opioid crisis. So, all of that to say, however, that one thing I've noticed about our drug and alcohol field is just how resilient we are and how cooperative and collaborative and supportive we can be of one another, given the circumstances of having two public health crises to deal with. So I think one of the positives is that our field has been a voice of positivity during COVID-19, because we've been able to share with the rest of the state and the nation that we recognize recovery, that it happens every day, and that people can be really resilient.
So how has this pandemic affected the people who you help support in your department, the people who are struggling with these substance use disorders?
Yeah, that's a good question. So in some ways, it's made it more difficult to access their services. And that could be because transportation isn't as accessible. It could be that they're a client who needs to go receive daily medication. And so now on a daily basis, they're potentially exposing themselves to the risk of contracting COVID-19. Could be that it's put financial hardships on their family that hadn't existed previously. And all of those stressors can ultimately be triggers for relapse. And so that's something we have to watch really carefully as a drug and alcohol community, is that we continue to be very supportive of individuals who want to seek treatment and for those who are already in recovery.
And how is your department working with those individuals to make sure that they get the support that they need and that they're getting the resources that they need?
I think most importantly is making sure that folks know that access to services still remains. And they may need to access it in a little bit different way than they did before, but those services still exist. So we've been pushing out information around our hotline. That number is 1-800-662-HELP. And that hotline is available 24/7, 365 days a year, even during COVID-19, to access treatment resources, but all kinds of other resources as well. So you can call and ask them questions. You can ask how to get in touch with a recovery support organization. Any questions that you might have that deal with drug and alcohol issues, you can feel free to contact the hotline with. So making sure folks know about that hotline, as well as partnering with some other organizations across the state who've been doing a great job of adapting things to meet the needs of people in recovery. So there's an organization called ProA that on their website offers all kinds of information about how to electronically access recovery support services. So we've shared that information on our website. Just making sure that from a social media perspective, we continue to send a message about recovery, letting them know where they can access the resources, pointing them to websites where they can find that connectivity. We really have to make sure that while they're quarantining, they aren't isolating themselves, that they're continuing to use the resources they do have at their disposal to keep those connections alive.
Now, this pandemic has not only affected those with substance abuse disorders, they've also affected the people who are helping to treat them and help them get better. How has this virus affected them and how they're doing their jobs?
Most definitely. It has caused some workforce shortage issues across the Commonwealth in terms of folks who would be treating individuals with substance use disorder. They may need to be self-quarantining. They may have children who aren't in school now, and so they don't have childcare. And so our field has really needed to be flexible and adaptable and figure out how do we do the same quality work that we did before, but we might have to do it in a different way. And some of that has come about through using telemedicine. So we've been allowing the use of video or telephonic means in order to do counseling in some cases. So that allows clinicians to stay home and be able to conduct their work without having to go into an office, and that helps with some of those challenges. We've really been taking it on a case-by-case basis with providers if they're having extreme workforce shortage issues, trying to work with them to address those needs.
Now, how have you seen the adaptability of your providers really change over the course of this pandemic as it's kind of spread throughout the state?
It's really been amazing, quite honestly. You know, I would used to like to think of us as a field that was adaptable and a field that was really trying to make the best use of technology and regulations. But I have to say that given the current circumstances, I've really seen that kick into high gear. Lots of questions about how can I think about this differently? What if I did this? Would it be okay if I tried that? And in some cases, we have to say, nah, that doesn't sound like the best solution. We have to make sure we're maintaining quality of care. But in other cases, we're able to say, yeah, you know, that's a really great idea. Let's do that. Let's try that. And making sure that anytime we're trying something new, that we're keeping the individual and their needs at the center of all of that decision making, making sure that every decision we make is based on doing the best that we can for the clients.
Now, you talked about how your providers are using telemedicine. Are there any other resources that your department has given them to help them do their jobs more effectively in such a hard time like this?
Yeah, one great example of that came on the heels of an announcement that the federal government actually made, and it's around the ability for providers to give larger doses of take-home medication. So up until COVID-19, there was the ability for providers, if clinically appropriate, to give up to a 14-day supply of medication for an individual on medication-assisted treatment to take home with them. And so they would only need to report every 2 weeks to receive their medication. The federal government was able to waive that regulation and allow for a 28-day supply. So if clinically appropriate, the individual would only need to report to the drug and alcohol facility every 28 days. So the state quickly followed suit, and we suspended our regulations in the same way to allow for that 28-day dosage. That does a couple of things. Number one, it helps reduce the risk for the patient of being exposed to other individuals that might have COVID-19. It also helps the provider from a workforce perspective, because instead of seeing those patients every 2 weeks, now they're only seeing them every 4 weeks. And so that helps in terms of caseload. So that's one great example of a way that we've tried to adapt very quickly.
Now, we only have about a minute left. What resources are you making sure that people who are suffering from a substance use disorder, their family members, their providers have at their fingertips so that everybody can be as prepared as possible to help each other, especially during this time of COVID-19?
That's an excellent question. I would point folks first to our hotline. That number is 1-800-662-HELP. It's available 24 hours a day, 7 days a week. You can feel free to call that number with any kinds of questions that you have, even if you're not directly seeking treatment. And I would also really encourage folks to just make sure that they're taking care of themselves. And if you're starting to feel too isolated, if you're getting a lot of anxiety, if you start to feel a little bit depressed, please reach out for help. And you can do that through our hotline. You can do that through the mental health crises lines that we have available in Pennsylvania. And please feel free to check out our website. We have a COVID-19 page specifically on the Department of Drug and Alcohol's website that lists all kinds of resources, whether you're a provider, whether you're a citizen, all kinds of links to places where you can get good information or get links for help.
Jennifer Smith, Secretary of the Department of Drug and Alcohol Programs, thank you so much for joining us.
We have 3 branches of government: executive, legislative, and judicial.
Voting is a civic duty. Voters are an integral part in government operations.
When I run for office, you can be my campaign manager.
Do you have a child curious about civic engagement? Support their passion with PCN Civics 101, a free online resource presented by the Pennsylvania Cable Network. Easy-to-watch videos take learners into the Capitol to see how our state government functions, meant to enhance your child's classroom studies. Go to PCNTV.com to start watching. PCN Civics 101, teaching Pennsylvania politics and policy.
Representative Jake Wheatley, a Democrat from Allegheny County, thank you so much for joining us today.
Thank you for having me.
Can you tell us a little bit about how COVID-19 has affected your district specifically?
Sure. I think it's similar across the Commonwealth. A lot of uncertainty, a lot of, fear and anxieties and frustration. This is something that hit us. I don't think we were totally prepared for what happened, but I think the governor and his team have done a great job in trying to steer us through this most difficult time. And in my district specifically, there are a lot of questions, of course, with businesses being shut down, with folk being out of work, schools shut down. There is a lot of anxiety. And I think what we've tried to do is work with our citizens to help ease some of those as best we can.
Now, you've offered several pieces of legislation in the past month or so. Why has it been so important for you to offer this legislation as it relates to COVID-19?
Yeah, I think because this was such an unexpected hit, there are a lot of our Pennsylvanians that weren't prepared financially for what happened. Small businesses weren't prepared for the financial hit that was happening. I think what we were trying to do is show them that we are listening. In my district, I've gotten a lot of calls, emails, texts, where people who are saying, hey, look, we need help. We're struggling. We don't understand why this or why that is happening. So our legislation that we're putting forth is taking from those individuals who've called me, offered up suggestions, and then we're using that to try to, we're the legislators, so we're trying to make policy that reflects what we're seeing on the ground.
So let's dive right into some of the legislation that you've proposed, one of them being the Emergency Relief for COVID-19 Workers Act. Now, what does that legislation do?
What we were trying to accomplish with that legislation is figure out a way to financially support a lot of these things that are happening to our small businesses and to our individuals. So the relief fund, we're predicating it on the potential of offering up a bond up to I think about $10 billion, where we could help a whole segment of folk. It could be the small business individual that needed some support. It could be the individual that was looking for some support. And so that's kind of a catch-all fund that we were trying to offer some ideas around how we can support different industries and individuals who have come to us and said, look, we're going to need some help coming out of this. And this fund would allow for us to do that from a state perspective.
Who would be eligible for this relief from this fund?
So there's different aspects in the relief fund, but certainly small businesses would definitely be eligible. We would have some component of this that could also help citizens access some of this. We have a uncompensated care packet that we're also talking about trying to help some of our healthcare facilities for those who are uninsured or lose their insurance during this time. So there are different components that the fund would kind to operate under. But our intentions was to really develop a pot of money, a state pot of money that could be directed towards relief and recovery efforts once we kind of get through this time.
Now, you did mention helping those who may be uninsured during this time of COVID-19. Why was it so important for the state to support, people who may be insured, but also the people who aren't and who really do need help?
Well, because I think in this time, our healthcare facilities, as we just saw, the governor talked about a pot, $450 million pot of money to try to help with the equipment side and functional side of the healthcare industry, try to help relieve the pressures on our hospitals. Well, in our opinion, this is the companion piece to that, because they might be seeing more and more citizens who come in without insurance, who come in without the ability to pay for the services that they are needing, and we don't want our healthcare facilities to end up after this in a situation where they also are going to face financial difficulties. So the uncompensated care fund that we want to create is really just another way to try to get money into our healthcare facilities to ease the burden of them seeing all of our citizens who's coming in, regardless if they have insurance or not.
So our healthcare systems, as you mentioned, are being hit in a financial way. What other ways are they being affected by this COVID-19?
I mean, their staff. I mean, think about it. The staffs themselves are being exposed each and every day to this. We know that when this first came about, the equipment wasn't always there. The safety measures weren't always there, and so there are a lot of anxiety even amongst our healthcare professionals about what this means to them and their families. So we certainly wanted to take our heads off, not only to the healthcare providers, but all of our essential workers who are out there each and every day, which is another component of our package. We wanted to provide hazardous pay for those essential workers. We're talking about those home healthcare professionals, those bus drivers, those law enforcement. They're working in a situation where many of them don't get additional protections or additional pay. And we think that's unfair. So part of our package is to provide for those who are working, who's essential workers and they're working in industries and they don't make $15 an hour, we would bump them up to $15 an hour. For those who are making $15 or above, we still give them an extra few dollars. I think it's $3 in our packet to go along for, and it doesn't cover all of the cost of being out there each and every day. But we want to say with our financial support that we appreciate you all coming out and keeping society running.
Now, you've also introduced legislation to release socioeconomic demographic data. Why is that so important to release, and what could it be used for?
Yeah, we think if we're going to be able to address this in any real rational way, we want to know who was impacted and how they were impacted, and having all of the data will help us drive policies. Because I'll use this as an example. If in fact the national statistics are right about African Americans and Latinos being impacted more so during this pandemic, then our response should be to focus on those who were hit the hardest, especially when they come from communities that were already hard pressed before the pandemic. And we can already see from a federal standpoint and even from a state response, our first initial response, which I understand, was just first come, first serve and try to stop the bleeding. But now, if we collect the data, we could be more strategic in our policy perspectives, so we can go right to those communities that are most hard hit and address those things as we try to recover.
So besides the policies that we've already talked about, is there anything else that the legislature is considering or that they're talking about with the governor's administration to help support those heavily hit areas here in the state?
Yeah, I think the governor just announced today a forming of an internal task force to kind of work with those most impacted communities. I think that's a great first step. I think we have to continue to look at this from an equity lens, because what I say to people, not all communities are equal and not all people are faced with the same set of contexts. So when we have our response, the response should go to try to help those who are least able to help themselves and weather this storm and then build back that way. I think we do have to support our very small businesses, because what we're learning from the federal stimulus packet is a lot of our smaller businesses, especially Black and brown businesses, weren't prepared to come into the pipeline. And again, first come, first serve. Many of them are still left behind. So our state response, I think we have to have another round. I want to again recognize the governor and Secretary Dennis Davin. They came out quickly with a pot of money from the PETA loans to kind of address the small business with a $60 million or more. But that went in like 5 days. So we need another round. I think in the second round, we need to make it more pointed. Again, going back to why we need the data should help us drive who are some of those small business and what are some of those industries that we need to protect. And then we need to project out, because when we come out of this, which we will eventually come out of this pandemic, we need to be ready to offer real recovery for some of these smaller business owners and some of these communities that are going to be devastated.
Now, you've introduced this legislation. Where is it in the legislative process, and how has legislation been moving during this time of crisis?
So like anything else, it's going to be an uphill battle. I'm a Democrat, and I'm in a process where the majority is run by Republicans, but I want to thank my colleagues in Harrisburg, because our concept around the demographic data actually was passed, or some parts of it was passed in a bill yesterday that's now in the Senate. So we are hopeful that will continue to move. So we think there are opportunities in here to be bipartisan. We think there are going to be a lot of need. We already know our financial situation is going to be something that we'll have to deal with moving forward. And I also have another bill. It wasn't part of this, but we talked about the legalization of adult cannabis, and we would hope that will be back on the table, because if we're talking about new industries and new opportunities, that's an industry that will offer us some way to bring some new revenues.
And as a final question, what further action would you like to see from the rest of the legislature and from Governor Wolf to help fight this pandemic here in Pennsylvania?
I think we have to continue to try to get in front of it and stop the spread, flatten the curve. But I also think we have to be very intentional to support. I'm going to keep harping on this because I think this is important. I think we have to be very intentional to support those communities and those individuals, be small businesses or businesses in general, that are coming from these hard-hit communities. And when I say that, they were hard-hit before the pandemic. And now we have to be very intentional to make sure that we move them from where they are now to a recovery period that is intentional to with the resources and the supports necessary. So that's what I'm just going to keep harping on to my colleagues and to the governor. I think that's very important for us to have a plan for that.
Representative Wheatley, thank you so much for talking with us.
Thank you for having me.
PCN is committed to providing the people of Pennsylvania with the most up-to-the-minute information about coronavirus. Daily special programming with civic, business, and government leaders and how COVID-19 is affecting the community. Airing weekdays at noon and 8 p.m. Live special coverage of the governor and the Secretary of Health, as well as programming designed to inform and assist everyone impacted. Go to pcntv.com for the latest information.
Douglas White, he's the Vice Chair and Professor of Critical Care Medicine at the University of Pittsburgh in the School of Medicine. Thank you for joining us today.
My pleasure. Thanks for having me.
Can you tell us a little bit about your job as a professor and what you teach your students in critical care?
Sure. Yeah. So I'm a professor in the med school at the University of Pittsburgh. I'm a critical care physician, and I'm also trained in ethics. And so a lot of the work that I do is in teaching fellows and residents and med students how to take care of critically ill patients, and then also around some of the ethical issues that can come up in patients in ICUs.
So what should people who have never been to medical school, what should they know about critical care and how it works?
Well, I think one of the main things that's important to know is that many times when patients are critically ill, either with lung failure or heart failure or sepsis, they're not able to speak for themselves. And so it's often that the doctors and nurses in the ICUs are communicating with family members or other loved ones to help make sure that the decisions made are consistent with the patient's values and preferences.
And how does that communication work between family and loved ones and the attending physicians and doctors?
Well, in normal times, the hope is that the family can be there in person, and typically every day the doctors and nurses would talk to the family and give them a bit of an update of how the patient's doing. If families, for whatever reason, are not able to be in the ICU in person, often these conversations happen via conference, teleconference, or video conference.
So not only are you a professor, but you've also studied ethics and you've done some research on allocating scarce resources. In a time of coronavirus and COVID-19, what are those resources that seem to be scarce for our healthcare providers?
It's actually, there are several different kinds of things that could be scarce. The most obvious and the one that has been getting the most attention is the ventilator, the thing that blows air into the lungs of people with respiratory failure. But it's also possible that there could be shortages of clinicians, of ICU doctors, for example. And it's also possible that there could be shortages of space. So as ICUs fill up with more and more patients, it may be that the limiting factor is having enough beds for critically ill patients.
Now, when we talk about actual equipment like ventilators or protective equipment for doctors and physicians, how do we go about making sure that we have enough of those resources and that they get allocated properly so that everybody has what they need?
Yeah, well, so the first question, how do we make sure we have enough? That, in my view, is the most important place that we as a society should be focusing. And there are a few different ways to do that. At the level of individual hospitals, what's happening is that hospitals are making plans to be able to double the number of critically ill patients they care for by, for example, closing down operating rooms and other areas of the hospital and turning them into makeshift ICUs. Every operating room has a ventilator in it, and so those ventilators would then be used for critically ill patients. The other level of this is that most states and the federal government have stockpiles of ventilators. And so states can make requests of the federal government to have essentially an infusion of ventilators to come. This happened recently in New York State. And so that's another approach that we can make sure we have the resources that we need.
And how do we make sure that they're allocated to those healthcare facilities, especially if they're coming from a federal or a state level?
Yeah, so this is where regional coordination becomes very important. It's not just that one hospital in Pittsburgh or Philadelphia needs to be making these decisions on its own. The goal is that all of the hospitals in the region are coordinating and are saying, for example, okay, hospital A is now entirely filled, all the ventilators are used, but hospital B just down the road has 10 open ventilators. And then the goal would be that patients would be transferred to hospital B who needed respiratory support.
Now, you did mention that some hospitals have been shutting down operation rooms to make room for more ICU beds. How else are hospitals and other healthcare facilities adapting to take this influx of COVID-19 patients?
There's many things that are happening right now to do that. One of, I guess, two examples are we are training up doctors who are not critical care physicians to be able to take care of critically ill patients. And that involves kind of a hierarchical structure where usually it's one critical care doctor might take care of 15 or 20 patients in a day. And we're setting up systems in which it's one critical care doctor taking care of 4 different teams that are overseen by another doctor. And each of those teams is taking care of 20 patients. So that's a way to allow one critical care doctor to now triple his or her effect or quadruple it and take care of 80 patients. The other thing, I would just say another example of what regions are doing, for example, in Pittsburgh, the emergency management groups in the region have made plans with the David Lawrence Convention Center to use it as an ancillary hospital, including an ancillary ICU, if things became so tight in existing hospitals that we needed more beds and more space.
Now, when hospitals are having this influx of patients, they might not have the room, they might not have the space. How are these healthcare providers making these decisions to help the greatest number of patients that they can?
Yeah, right. So this is the hardest part of the conversation, and the part that we hope never comes to pass in Pennsylvania. And it's looking right now like we have enough ventilators currently. But if things change, or if, for example, the physical distancing, people stop with that, it could be in several months that there is another big surge of cases. And then the hard ethical question that comes up is, if there are not enough ventilators to go around, how should we prioritize allocating them, knowing that there will be some patients who don't get them. And the framework that exists in Pennsylvania and work that I and others have done have really focused on a couple things. First, no patient should be excluded from consideration who is normally considered. And this is a big departure from how some states and professional society guidelines are recommending and handling things. So, for example, some states have said patients with severe mental retardation or advanced dementia should not be eligible for admission to an ICU. And we take the view that that's ethically very problematic and probably runs afoul of US anti-discrimination law. So everyone is eligible. And then the next step is in our framework is allocating the ventilators according to those who are most likely to survive the hospital discharge and who don't have an end-of-life condition such that even if they survive the hospitalization, they would die in the weeks, months, or short period of time, what we call the near term after ICU discharge.
Now,
I would just say the whole goal is to treat as many patients as possible on down that list until there are no more ventilators.
Now, how did this framework come about? How did you and your colleagues in Pennsylvania as a state come up with this way of, if we don't have enough ventilators, this is how we will allocate them?
This work started back in 2007, around the time there was the SARS outbreak in China and Toronto. Then there was the avian flu outbreak, and then shortly thereafter H1N1. And all of these respiratory viral illnesses raised concerns about shortages in ICUs. And so I and my colleagues looked at the existing guidance that I mentioned that focused on excluding large groups of patients from ICUs. And we said, this is not okay. We need to find a better way to do this. And so we embarked on what's turned into a 10-year endeavor that both involved ethicists and critical care doctors and disaster medicine experts, as well as the public in a several year-long public engagement process. So the work was really started a very long time ago for a very different respiratory pandemic, but the intention even then was to make it generalizable to whatever comes down the pike.
Now, when we talk about hospitals and healthcare facilities, people might be hearing the word triage. Can you explain what that is and how that would affect treatment in those hospitals and facilities?
Mm-hmm. So the idea of triage is just means to sort. And it means essentially in the conversation we're talking about here, among all the patients with respiratory failure, identifying those who are most likely to benefit and making sure that they get treated first, and then when there are more ventilators, giving it to the next group of patients in terms of their likelihood of benefit on down that list.
Now, is this some sort of guidance that would come down from the state level, from the governor's office?
Yeah, so the Commonwealth has issued what are called crisis standards of care. This was released earlier this week after several rounds of revisions to make sure that the guidance is maximally responsive to concerns of a variety of patient groups, including those with disabilities. But yeah, so that there is guidance that is issued by the Department of Health that gives hospitals in Pennsylvania very clear guidance on how triage should play out.
And as a final question, is there any other guidance or resources that you'd like to see from the Department of Health or from the governor's office as to what healthcare providers and healthcare facilities should be doing to help treat COVID-19 patients at this time?
Well, maybe not so much from the governor's office or the Department of Health, but I think all doctors right now are really interested in knowing what are the main predictors that someone who develops an infection is not likely to do well. That's the thing that we all don't yet understand. We've have a general idea that folks who are older don't do as well, and folks who have severe heart and lung problems tend to not do as well. But we feel like one of the big missing links right now is a really strong model, a prediction model that helps us identify the patients most likely to benefit and those who are probably going to die no matter what we do.
Douglas White, thank you so much for talking with us.
Thanks for having me.
During the uncertain times brought on by the coronavirus outbreak, PCN remains committed to the needs of Pennsylvania and its people. PCN provides free daily coronavirus updates from Governor Wolf and the Department of Health Secretary Dr. Levine, live, on air, and streaming on the app and online. These updates will be available to watch in their entirety on demand for free by downloading the PCN app or at pcntv.com. PCN, committed to keeping Pennsylvania informed.
Guy Triano is the CEO of the Southeastern region of the American Red Cross. Guy, thanks for joining us.
Thanks for having me.
The pandemic isn't necessarily the first thing that comes to mind when you think of the Red Cross. How have things changed for the Red Cross in what you guys are focusing on?
Yeah, thank you. Even during a pandemic, the Red Cross is still responding. Disasters, house fires, blood collection, the need for blood, all still continues through it. It's just the way we do things a little bit differently during the pandemic is how we have to go about it. But the services and the people are still in need of the American Red Cross.
So talk about what happens when there is a fire or a natural disaster during this time. What do you guys do?
Yeah, well, currently right now, we are still responding. Number one concern that we always respond to are everyday house fires, and they are still continuing throughout this. We're just doing things differently a little bit, where we are doing a lot of virtual responses, where we're still being in touch with the client, speaking with them, providing them any assistance that they need, up to and including financial assistance and hotel stays. So we're still doing it, we're just doing it virtually. And in times where there's large disasters or large fires or flooding, where we have to go out face to face, we practice social distancing, but still keep the clients first in mind.
So how do you practice social distancing when there's really that need for intimate contact? Seems like it's pretty necessary.
Yeah, well, what we're doing is, first and foremost, we're having conversations with the individuals prior to approaching the house or approaching the disaster. We're wearing masks. That's one thing that we're doing. All of our volunteers, all of our paid staff are wearing masks. We're also providing masks for the clients if they don't have one at the time. And a lot of the conversations that can still happen at 6 feet apart to provide them the assistance that's necessary.
And so what are the other things that you focus on? You say fires, natural disasters. Another thing we think about is blood. What's the state of blood giving and how is that process happening?
As of Monday, there were over 19,000 blood drives countrywide that were canceled, over 540,000 donations. That started early in March when we started with COVID-19, where cancellations are mostly predominantly at your high schools, colleges, and also your businesses that are all working now virtually. They canceled their blood drives. Obviously, in the state of Pennsylvania, the governor last week made the mention that there will be no more schools going back. So we've lost all of those blood drives and continue to. Fortunately, the donations have been able to keep up with the supply and the demand of the hospitals, because a lot of elective surgeries have been canceled in the hospitals. So our blood supply has been at a very good level and continues to be, and we monitor that constantly. What we do at blood drives, because they are considered essential, and we are allowing blood drives to continue, and the public has really rallied behind that and really have kept our blood supply at good levels, we are practicing lots of different things due to COVID-19. For one, social distancing as much as possible is happening at blood drives. We are offering the donors, as well as all of our staff and volunteers, masks to donate. We're washing hands frequently. We're disinfecting the surfaces often. And one big thing that we're doing is, before anybody, both staff, volunteers, and donors, walk into the blood drive, we are checking their temperature prior to them even walking into the facility to make sure that they are COVID pandemic free.
So what should someone do if they wanted to give blood?
So what we are asking people to do, and obviously the need is ongoing, and we continue to see that this will be an ongoing need always, especially in the next coming months as we enter the summertime. It's extremely important during this time to make an appointment to donate blood. So they could do that by going on redcrossblood.org or calling 1-800-RED-CROSS. It's so much more important this time than ever to schedule an appointment so that we can properly staff the drives and then properly work the social distancing to make sure it's a good experience for the donor and for the staff. If you have a lot of walk-ins, it's very hard to kind of control that. So what I highly encourage people is to consider donating. Please donate. We certainly need it, but make an appointment. Even if it's 2 or 3 weeks out when your next available appointment is, it's going to be needed then.
And what about volunteerism? We're quarantined currently. So how is there a need for volunteers, and what can people do to help?
Yeah, there's always a need for volunteers. 90% of our workforce is volunteer driven. We can't help people without volunteers. So there are still volunteers that are helping out at blood drives, for one. There's also a lot of virtual experiences where you can help out. So if you're interested in being a volunteer, redcross.org to sign up to be a volunteer, but you can make phone calls to houses. You can do a lot of virtual things with our service to armed forces. You can actually do some of our DAT responses, which is our disaster action team, or our casework via the phone. So there's plenty of opportunities that we can work through it, both virtually, and then hopefully when we are done with social distancing, we could have them as a lifelong donor and get them more involved with hands-on opportunities. But certainly plenty of virtual opportunities for volunteers.
And you mentioned that there was something in the works with people who may have had the virus and come through it, and then their blood is has the antibodies that could help fight this in the future.
Yes, we are. The American Red Cross is partnering with the FDA. We're in the very early stages of this, but where we're collecting plasma from recovered COVID-19 patients to help current patients with COVID-19. Again, it's in the very early stages. You can find some information on our internet, but we are one of the first ones to be working with the FDA on this, and we've actually had a couple of collections for that and for that purpose. So it's a great thing. We're obviously trying to figure this out as we go, but this is a unique opportunity. Again, it's for recovered people that have tested recovered, that do not have the virus, that had it, that would like to donate their plasma, which in hopes to help people that have COVID-19. Early stages, more information on redcross.org.
All right. Well, Guy Triano, CEO of American Red Cross Southeastern Pennsylvania, thank you very much.
Thank you so much. Appreciate it.